Hey guys, welcome to episode 3 of the channel, and today we're going to talk about hair transplants. So in the last video I think we talked about medication, finasteride and minoxidil, but those medications are not magic. They're not going to grow all your hair back. If you look on the Tresless subreddit, every now and then there are pictures of guys who we call hyper responders, and within a few months, a year, 2 years, they've like regrown all their hair back. That normally does not happen. So finasteride will stop you from losing your hair, mostly, and minoxidil will stimulate some growth, but like if you have a receding hairline with areas that have like zero hair, you're not going to regrow basically anything. So after that, you have the option of getting a hair transplant. So in this video, we're going to talk about what is a hair transplant, what it can do, what it can't do, what is a good candidate for a hair transplant, who is a bad candidate for transplant, and some issues regarding the recovery. So what is a hair transplant? A hair transplant is when they take grafts of your hair from the back in what we call safe zone or zones, and then they surgically implant it into your balding areas. You do not have unlimited amounts of safe donor zone grafts. You have maybe 6,000 if you're lucky, maybe more if you're really lucky, and potentially less than that if you're unlucky, which we're going to talk about in a moment. So again, what is the hair transplant? They take hair from the back and implant it into the front. And right now you just heard me use the term safe donor zone. What is that? So in the previous video I explained why one goes bald. You go bald because of DHT. That attacks your hair follicles, makes them shrink, and then your hair falls out. But if you look at bald guys, they generally have the horseshoe shape, so they still have the hair on the sides and the back. That hair is not immune to DHT, but it is resistant. That's why old guys, they're completely bald on top, but they still have some hair on the sides and the back. That's why we refer to those hairs on the back as the safe donor zone. That's why they are used in a transplant. So all the hair on the top of your head is not resistant to DHT. Well, for people who suffer from male pattern baldness, that's why. Okay, and now let's talk about what one can hope to achieve with a hair transplant. So it's very important to view a hair transplant as not some magical surgery that's going to make you have a full head of hair. It's not possible. Think about it. If you have an entire bald head and you have a strip of safe zoner hair at the back, just do the math. It's not possible to even move all of that hair to the top. This estate is bigger than this housing estate, if you get what I mean. So what is a transplant? What can it achieve? A transplant can achieve the illusion of a full head of hair. That's all. It is achieving the illusion of a full head of hair. Basically a very, very fancy comb over. You can kind of see this when you look at the styles of hair that people with hair transplants go for. They generally go for short haircuts, very short on the sides and the back, and relatively short on top. They don't go for long hairstyles like this. It's not possible. They go for short, and I'll tell you a secret. Most of the YouTubers, the transplant guys, the guys who show off their fancy transplants, I bet 9 times out of 10, those guys are using hair fibers. And we're going to talk about hair fibers in a future video. So yeah, you have to be realistic. You're not going to get a full head of hair like you did when you were 17, 16. You're going to have a much thinner head of hair. But if you have a good surgeon, they're going to construct the hairline in a way which will look good with certain hairstyles. And now we're going to talk about good candidates versus bad candidates. So this is a thing which people don't even think about. Like, you have bald guys who really want to get a transplant because they really want to have a head of hair, understandable, but they don't even consider, am I a good candidate for one? Am I a bad candidate for one? And a lot of these guys, they go to hair clinics in places like Turkey, and we refer to those places as hair mills, which is not a good connotation. And those doctors, sometimes they don't tell the truth. Sometimes they just want to sell the surgery. So if you go in and you're a bad candidate, they're not going to tell you that you're a bad candidate. You have to know yourself. Are you a good candidate? Are you a bad candidate? There are good doctors out there. You'll find a good doctor who will just refuse to give you a transplant. Okay, so what is a good candidate? A good candidate is someone whose hair loss has somewhat stabilized. How do you stabilize your hair loss? Medications, finasteride. Or in some cases, with age, your testosterone drops, which means your DHT levels drop, which means eventually your hair loss sort of slows down. And if it has slowed down enough that your hairline has sort of remained the same for years and years and years, you can kind of get away with a transplant. But yeah, medication. You need to be on finasteride. So if you have balding going on, but you've stopped the hair loss with medication, finasteride, you are potentially a good candidate. So potentially, why potentially and not definitely? Well, it depends how far your hair loss has progressed. If you're like completely sleek bald on top, it's probably likely that your sides and your back have also already thinned, and you might not even have noticed. So if your sides and the back of your head are already thin, you are a bad candidate, because that means those hairs are not all that resistant to DHT. So you're going to be taking out weak hair, and you're not going to have a big number of available grafts to begin with. You're going to take that out, put it on the top of your head, and it's going to be fine and thin, and they're probably not even going to survive. If they do survive, they're going to fall out because DHT is going to continue to attack them if you're not stabilized. And think about it. If you take hair out the back of your head, it's going to leave scars. So if you have a thin back, you take out too many grafts, put it on the top, you're never going to have a nice looking scalp at the back. You're going to have to hide it with the hair you do have left, which is going to be thin, or there is a tattoo method, which I'll probably talk about in a future video. So yeah, a good candidate is someone who's had minimal hair loss, they've stabilized their hair loss, and the sides and the back of their hair are still thick. And right now, again, we're going to talk about medication for a very short time. I've already talked about it. You need to stabilize your hair with medication before you do the surgery. I think good doctors will recommend you go on these medications at least 1 year before the surgery, sometimes 2 years. And then after the surgery, you have to keep taking them. Why? Well, if you don't take finasteride, then the transplanted hair, we hope, will not fall out because it should be DHT resistant. But all the hair behind the transplanted hair, I see this all the time, like people don't even touch their mid-scalp or their crown. They don't even touch them with grafts and a transplant. And most people who get transplants done, they're already thinning in these areas. So if you're not on medication, your mid-scalp and your crown are going to continue to bald, and then you're just going to have this stupid looking transplanted patch of hair at the front, which you're never really going to be able to shave off. You can shave it down to the bone, it will look fine apart from the scars, but if you give yourself like a buzz cut, when you're all thin here and you have this weird unnatural patch of hair, it's going to be very obvious. It's going to look like doll hair. Okay, now let's talk about length of recovery time. So a transplant is a surgical procedure. You're going to have like a week, 2 weeks off work after you get transplant, because your head's going to be all covered in horrible scabs. It's going to be like bleeding and stuff. And I don't think you're even allowed to sleep lying down. You have to sleep like in an upright position so that you don't mess up your scalp. But then after the immediate recovery time, where your scalp, the skin starts to heal, all of those hairs that you got grafted into the front, they're all going to fall out. It's just something that happens. They fall out, and even some of your natural hair that was already there, some of that will fall out too because of shock loss. So yeah, you're going to look worse than you did before the transplant after about 2 weeks. People call this like the ugly duckling phase or whatever. I don't know. So yeah, the transplanted hair falls out. You get some shock loss on the hair you already had. So you're in a worse position. And people freak out. They're like, oh my God, my hair transplant has failed. Like, no. It's going to take months. Like at least 3 months before those grafts that fell out, at least 3 months before they start to come back. But even when they do first come back, they're not that strong. They're kind of weak. It takes a few cycles. It takes a few times for them to fall out and grow back before they get thick and look like good hairs. So yeah, it's going to take 3 months-ish before you start to see it grow back. It's still not going to look good. That's still the ugly duckling phase. And then people say around the 6 month mark, that's when it starts to look better. And then 9 months, 12 months, 13 months, 14 months, that's when it starts to look good. So be aware that the recovery time of a transplant is long. The immediate recovery time, as in recovering from the surgery, that's going to be like 2 weeks, 3 weeks. But then the recovery time of your hair, the time it takes for your hair to look good, that takes like a year. And I just mentioned this little phrase that people like to use, failed transplants. People post all the time on Reddit, oh, it's been a year, it's been 2 years, it's been 3 years since my transplant, and I'm bald, my transplant failed. Transplants can fail because sometimes the grafts die, but normally those guys that post these posts, their hair transplants have not failed. They have failed themselves. Why? You guessed it, they did not take finasteride. And just one more point I want to make. A lot of guys who post their before and their afters, stuff like that, on the transplant subreddit, they talk about their donor zone healing. And I think a lot of guys have the wrong idea of what that means. So when you get grafts taken from the back, every single graft that you get removed, that leaves a little scar. And I don't know if you know, but scars do not heal. I mean, they kind of fade after years and years and years, but they don't heal. So people talk about their donor zone healing. No, it doesn't really heal. What happens is the hair you still have there, hopefully you still have a good bit of hair, but over harvesting does exist, that is a thing. The hair you have remaining should cover the scars. That's what healing means, but it doesn't actually heal. So if you have an over harvested donor zone, those scars don't go away. And if you don't have enough hair to hide them, you're done for. Your scalp's on the back of your head's never going to look good. So I just want to make that point. Like, a lot of people talk about their donor zone healing. It doesn't heal.